confusing with the sidebar there, but I got to keep eye on people coming in who keep joining late, so I can see in this view much better. But hopefully it doesn't affect how you guys can see the presentation, right? So my name is Dr. Ernesto Medina, founded For Healing Health and Wellness Center in Round Rock, Texas. Been open a little over a year, and largely a functional medicine, nutrition-based health center. We work with a lot of people suffering with chronic unresolved symptoms that traditional medicine has often failed to help them with. And we do that through looking at diet, nutrition, and lifestyle strategies and how they can help improve chronic symptoms and improve overall health and vitality, which is a very different concept than traditional medicine, where you have a symptom, you have a diagnosis, you get a medication for that symptom, right? And so sometimes that can cause additional problems. Sometimes it doesn't address the problem to begin with. Sometimes it just ignores the underlying root cause of that symptom in the first place. So that's what we strive to do. And we do that through pretty comprehensive examinations and blood testing, laboratory analysis, right? And so the first topic is on an inflamed brain fog, because what you're going to find out as we go through this presentation is this concept, there's no diagnosis for brain fog in conventional medicine. It doesn't exist. And so if you're struggling with common brain fog symptoms like brain fatigue, short-term memory issues, retention issues, maybe not as cognitively quick, you can't catch new information and learn it as quickly as you used to, right? Those all can be signs of brain fog, right? And if you talk to your primary care doctor, you tell them you're experiencing this, right? There's no objective test to test for those things. And so you'll probably get ignored, told, oh, it's nothing, you're just stressed, so on and so forth, right? But as we get into this presentation, you're going to find out it may be an early warning sign of something more important, something major that may be coming. So we'll talk about that more in detail as well, right? And I also chose to focus on this topic first because it's one of the top complaints we get patients who come to our office. Brain fog is one of the number one issues people bring up, and they just don't know how to fix it. And after years of working with people with such an issue, it's usually a pretty easy fix as long as we can figure out the underlying cause of that brain fog. Right. So there's our website, forhealinghealth.com. You can follow me on social medias at dr.ernesto_medina_DC. I post a lot of free educational content on there, health related. I get a lot of questions too from people who follow about different health issues or conditions. And so you can follow me there. And if you have specific questions or topics that maybe I don't cover, maybe you can bring them up there if you're interested, all right? Quick disclaimer here. None of this information is intended to treat or diagnose any condition. This presentation is just for informative purposes. Always consult with the advice of your personal healthcare provider before starting any kind of new treatment or medications or supplement, anything like that. But like I mentioned at the beginning, some things like brain fog, conventional medicine has no answer to, right? So hopefully this informational webinar can give you at least a starting point. All right, so what is an inflamed brain? Another term for this could be neuroinflammation, which means inflammation of the neurons, brain cells specifically. And the way it's defined is activation of the brain's immune system in response to an inflammatory challenge. Right. And so what is an inflammatory challenge? What triggers this immune activation in the brain? And this is pretty relatively new information that's been getting researched and published over the last 5 to 10 years. The technical term, if you decide to look for research papers, is going to be called microglial priming or microglial activation, which is just the technical term for immune cells in the brain that get turned on and activated, causing neuroinflammation. And so these are the most common causes of neuroinflammation. So we've got concussion or traumatic brain injuries, which is TBI. We have infections, and this can be any infection, any cold, any viral infection, any bacterial infection. And this became a lot more well known during the time of COVID, right? Some of the most common signs and symptoms of early COVID infection were loss of smell, which means, all those neurons that control smell are in the brain. And so COVID had this unique ability to get into the brain and affect the central nervous system. But really, there are many viruses and bacteria that can do this. So infections can definitely activate the neuroinflammation response in the brain, activate the immune systems, and start contributing to brain fog and brain fatigue. Autoimmune diseases. So one of the most common that we see in our office is thyroid autoimmunity called Hashimoto's. I'm going to have a whole separate webinar on that specifically. But really, most autoimmune conditions are based in inflammation driving that issue. And inflammation can drive inflammation in the brain, which is neuroinflammation. And then our last most common cause is going to be extreme psychological stress and or psychological trauma. Okay. Now, as we go through this, here are the most common symptoms of neuroinflammation, right? So the brain fog symptoms, the most common, but if we were to break that down even further, we have unclear thoughts, poor brain endurance, or quick fatigability of the brain, meaning let's say you do some sort of brain heavy task, some sort of cognitive task, and it could be something as simple as reading a book, reading a research paper or something like that, and you start to get through it and you realize you're not understanding what you're reading, or you have poor retention of what you're reading compared to what you used to, or you start reading and you just get tired and sleepy and you lose focus. The next bullet point, slow and varied mental speeds, right? So again, maybe early in the day you feel sharp and quick to comprehend new information, but later in the day you realize you have to hear it 2, 3, 4 times before it really sits in and you understand it, right? That varying in mental speed is brain fog and potentially brain inflammation. And even ADD, ADHD type of symptoms, right? Is if you look at the common symptoms of ADD, it's just poor attention, poor retention. And so oftentimes as adults, maybe as a kid, you never had ADD, but as adults, you think you start to develop ADD, and it's really just poor attention and comprehension of learning new material. And then depression and anxiety. Now, this is a big one. Now, I do have a whole separate course on holistic approach to mental health conditions, specifically depression and anxiety disorders, because all the latest research is showing that those are not necessarily conditions of an imbalance of chemicals in the brain. Really, what drives these imbalances in the brain is inflammation of brain cells, so neuroinflammation. And I've got a whole separate webinar on that topic that we get into pretty big detail, right? And then at more severe levels, let's say early signs and symptoms of neuroinflammation are those that I just talked about. More severe as they continue to progress and nothing is done to improve is going to be signs like early dementia, right? Really bad short-term memory, right? Chronic pain conditions, dizziness and vertigo, and then something called orthostatic intolerance, or inability to change position of your body because your blood pressure either drops or spikes uncontrollably, which leads to a heart rate changes uncontrollably, and pretty complicated issue, but can be driven from brain inflammation conditions. All right. So like I mentioned, the end result of uncontrolled neuroinflammation can be, at the worst case scenario, a neurodegenerative disease like dementia or Alzheimer's, Parkinson's disease conditions, something called ataxia, which is loss of balance and coordination, which eventually leads to a major decrease in quality of life, right? And you may be experiencing, or someone you know may be experiencing some of these early warning signs, and maybe you convince a doctor to run some brain imaging studies like a brain MRI or a CT scan. But more often than not, those imaging studies will look completely normal, right? And this becomes the big conundrum that exists in medicine, because you experience all these cognitive or neurological deficits or loss of function, but a brain image will look completely normal. And so you'll get told oftentimes, well, everything looks fine. You're just stressed out, or it's just psychological. And so nothing is really done until it progresses to the point of full-blown Alzheimer's or full-blown Parkinson's disease. And what's really amazing is, in order for these diseases to be able to be viewed on an image study like an MRI, usually you need such profound progression of the disease that it's already considered late stage, right? If I take a step back, a lot of these can be early warning signs that something is wrong in the brain, something is going on. It needs to be addressed deeper, or at least investigated into deeper, before it progresses to the more severe states of these neurodegenerative diseases, right? And maybe it never progresses to Alzheimer's or Parkinson's, but it progresses to severe loss of balance and coordination, right? So that's a major risk for, especially in the elderly, for falls, breaking of bones, breaking of hips, which also leads to decreased lifespan. Right? And so these are some resources, some books, if you're interested in reading more. This first book here, called The End of Alzheimer's, a fascinating book written by a medical doctor, medical researcher out of California, who showed through a targeted nutrition and dietary program, he could improve and in certain cases reverse cognitive decline and dementia in Alzheimer's people through a very specific nutritional plan. And the other book here, Why Isn't My Brain Working, is another great book, but it's a pretty dense read. It was written for doctors and clinicians, so you can get a little lost in that book, but also another very fascinating book on how targeted nutrition and diet plans can improve cognitive function to the point of regressing from dementia to a healthy functioning brain again. Well, maybe not healthy, but definitely functioning better than it was. So the big question becomes, how can I strengthen and improve my brain health? Because in the end, this is what I want to give to you, some practical steps you can implement today to start tracking and improving your overall cognition and brain health. So in order to do that, you need to understand the basic concept of brain cells 101. And this is a very basic physiological concept of brain cells or neurons and what they need to function at their highest level. And number one is going to be fuel or energy. Number two is going to be oxygen. And number three is going to be activation of those brain cells. Because in the end, the brain is like a muscle. If you don't use a muscle, it goes away. You get weak, you lose that muscle, and it starts to atrophy. The brain is exactly the same way. And so if you don't use certain parts or aspects of the brain, the body or the immune system says, well, we can downsize because we're not using this area, and it starts to deteriorate away. Just like a muscle, the brain will atrophy away into nothingness. Right? So let's dive a little bit deeper into this. So fuel for the brain. Essentially, what's the fuel for the brain? Well, the food we eat. Our calorie intake, imagine that being fuel for a car. Okay? Calorie intake. And calorie intake is often measured in the blood through levels of insulin and our blood sugar, right? So we eat food, those are our calories we take in. Our body either uses that or it sits in the bloodstream as excess calories, and we can see that as high levels of insulin, high levels of blood sugar, especially in the fasted state. We get a more accurate measure of what that looks like. And so we have to consider, as far as fuel for the brain, whether these levels of insulin and blood sugar are too high or too low. Too low meaning you're not fueling enough, so you're not eating enough calories, or too high being you're over consuming either sugars or processed carbohydrates, or over consuming calories and you're not burning them in muscles through exercise and movement. Both of those, both high and too low, both of those concepts will affect how your brain utilizes its fuel for energy. It'll either have not enough, which is very common. I find that a lot in my office with people. Or when you're in a pre-diabetic or diabetic state, your brain also loses the capacity to use that calorie intake and that sugar for energy, right? That's the whole concept of insulin resistance, or what I like to call it as pre-diabetes. Okay. And I have a whole nother webinar based around pre-diabetes and diabetes and how to find early warning signs of that and how to construct a nutrition program around that to improve those, right? And it starts with measuring fasting insulin and blood sugar levels, right? And then when we want to figure out our proper calorie intake, believe it or not, I find a lot of people in my office actually are under consuming food and or under consuming protein. And both of those are essential building blocks of the fuel the brain needs. All right. So how do we figure that out? Easy enough. You can Google basal metabolic rate. So you can find on Google a calculator for basal metabolic rate. It's going to ask you what's your height, what's your weight, and then what's your activity level. And it'll calculate a number of baseline calories you need to be consuming essentially to function. And so basal metabolic rate refers to, if let's say you were in a coma, how much calories they need to feed you in a coma to keep you alive, right? So that's basic calorie intake just to stay alive, not even including activity, movement, and exercise, right? And so you can select in that calculator, it'll ask you like, what's your activity level, low, moderate, or high? And then it'll increase your calorie intake from there, right? So that's number one. So baseline, make sure, are you even eating enough calories to keep your body alive, right? Because if anything, you're starving your brain from functioning the way it should. You're starving your brain from fuel. And I find this very often in patients, especially in women who tend to be a smaller frame, thinner, maybe underweight, and they're trying to stay thin. And so they undereat and they feel like they're eating all day and they're eating a lot. But when we actually count and measure their calorie intake, it's well below 1,000. And I can tell you baseline for most people is going to be anywhere between 1,200 to 1,500 calories just to keep a body alive, right? So that's number one. Number two is going to be, and equally as important, eating enough protein per day. Now, the range is going to be anywhere from between 0.6 to 1.0 grams per pound of body weight. Okay, this is a general range. The ideal is going to be 1 gram of protein per pound of body weight. So if you weigh 150 pounds, you should be trying to eat 150 grams of protein. All right, that's ideal. But oftentimes with patients, when I work with them, I tell them that, they think, oh my gosh, that's so much protein, I can't do it. So we start at 0.6. We try to build that up as a habit. Once they can consistently hit 0.6 grams per pound of body weight, then we ramp it up to 0.7, 0.8. Eventually, we work up to 1 gram of pound per body weight. And I can tell you, if you think you eat enough protein, you're probably not. It takes work and planning to make sure you're eating enough protein in every meal, right? It's not an easy endeavor. It took me maybe about a year before I was able to consistently hit my 1 gram per pound of body weight, because it took a lot of work and trying to plan meals. And if you do anything, at least pair a protein with every meal you have. Start there and then slowly try to ramp up from there, right? So that's number two. And then the last piece is going to be fill the rest of your calories with vegetables. Remember, if we want to try to avoid this pre-diabetes or insulin resistant state, you've got to minimize processed food, packaged food, and focus on fresh fruits and vegetables and hitting your protein number, right? I cannot stress this enough. This is probably the game changer for most people. The tricky part is making that a habit, right? And that's really where we shine with working with people one-on-one. We have them journal on what they eat each day, what time they're eating, how much they're eating, and we try to coach them in how to do this in an appropriate way. All right. All right. Our next point, oxygen, the next important basic function of brain cells. And so here are your big things to look at that can affect oxygen and blood flow into the brain. Number one is going to be having sleep apnea. Now I'm going to talk a little bit about more about that. So I'm going to skip over to the next one, uncontrolled high blood pressure. All right. Now, typically this gets caught at your yearly physical with your primary care doctor. If you haven't had a physical exam in a few years, buy yourself on Amazon a blood pressure monitor. They're cheap. You can check at home and make sure that is optimal. Okay. Low blood pressure often gets missed. And this is another big issue. And this is usually presents in people who are already under eating. They most likely don't exercise. They're underweight. They have chronically low blood sugar issues. They will often have low blood pressure issues as well. So this is something I always have to screen for in my office to make sure this isn't a contributing factor. Because again, like I mentioned, if you're under eating, if you're overstressed, and definitely not eating enough protein and underweight, chances are you have poor blood flow to the brain, and that presents as low blood pressure. And then being anemic. Now, again, more common for women, not always for men. Women, because of their monthly cycles and menstrual bleeding, that can often deplete iron levels. And iron is one of the main contributors of anemia. And what iron does in the blood is it binds to red blood cells and carries oxygen. And so if you're iron deficient, if you're vegan or vegetarian, there's a good chance you're iron deficient. Not always, but it often happens. Then your red blood cells are not binding enough oxygen to carry throughout the body, and especially to the brain. Okay, so this is very important. And again, a comprehensive blood test can screen for that anemia issue. Now, let's talk about sleep apnea a little bit deeper. Now, this is something that often gets missed in people, largely because the gold standard for diagnosing sleep apnea is going to be a sleep study. First of all, you got to convince your doctor to order you the sleep study. Then you have to go to a clinic and get it done. Oftentimes, insurance won't pay for it. And then the way these are done, sometimes you put this huge like helmet type thing with electrodes on your head. Then you have a Holter monitor strapped to your chest with a bunch of wires coming out. Nobody can sleep like that as it is with all that machinery on. Sometimes you have to sleep like in a clinic so that they can record your numbers, or sometimes they give you an at-home unit. But again, it's very difficult to sleep with all those things on you. And so how accurate is it is a big question, and paying for it is a whole nother issue. What I did is, this is a cool little device. It's called a Get Well U is the company. And what it does, it's a device that sits on your wrist, and then the gray rubber device sits on your finger. And what it is a pulse oximeter. If I take a step back here, these pictures, you see a blood pressure monitor here, and at the bottom, you see a pulse oximeter, right? These became very popular during COVID to measure oxygen levels. What this device is, it's the same thing, but it's designed to stay on and read your oxygen throughout the night. It means it measures your pulse rate and measures your oxygen levels through the night. And then it syncs to your phone. It gives you a really cool graph about how your oxygen levels remained through the night, whether they dropped or they spiked, and what your heart rate did as well. It's cheap. It's like 150, 60 bucks, but it's pretty cool device. I've got pretty good results with it. Again, it's not the gold standard, but at least it will give you an indication of how well you're breathing through the night, right? So if you snore or if you're a mouth breather, there's a good chance you're not getting good oxygen to the brain through the night. Mouth taping, I don't know if any of you have heard of mouth taping, but it's becoming very popular. And it's a concept where if you typically mouth breathe through the night or you snore really loud, there's a tape you can buy, you put over your mouth, it keeps your mouth taped shut, and it forces you to breathe through your nose through the night. And there's a lot of new research coming out on how beneficial this is and how much better it gets you into deep sleep, because it's forcing you to breathe through your nose through the night. So you can look into that, mouth taping, new information within the last year, but that's another available option. Right now, let's get into again. Let me take a step back. This is not gold standard diagnosis, but it'll give you an indication of how you're breathing through the night, and then you can talk to your doctor if you need to about getting a more in-depth study done. Now, activation. This is the last big piece here, activation. So you can see this image, we have the brain. The brain is divided into sections based on its function. So each color, you can see the frontal lobe is one section, in yellow a different section, in green a different section, in red a different section, and then just below that in no color is a different area of the brain. And each one of these lobes has a different function. So remember, like I mentioned, if you don't use it, you lose it. There are certain parts of this brain that if you don't use them, you lose them. And so the frontal lobe is primarily known for as the motor cortex. So all movement initiates in this part of the brain. The frontal part is also known as the area of executive function. So an activity that really lights this part of the brain up is meditation and mindfulness meditation. All right. So you have, that's a strategy. You have movement or exercise, another strategy. In the yellow, we have the parietal lobe, which is known as your sensory cortex, right? So feeling, touching goes there. We have the temporal lobe, which is also known as your auditory cortex, so hearing. But the layer deep to that, underneath, if we peel this back, we have what's called the hippocampus part of the brain, which is your short-term memory. That is where Alzheimer's essentially starts to attack, right? So memory and challenging your memory through different games, and we'll talk about a little bit of those therapies you can use, but challenging your memory centers is very important as well. And in the back, we have the primary visual cortex. Underneath that, with no color, we have the cerebellum. And the cerebellum also plays a very important role. What it does, it helps balance and coordination. So again, between the cerebellum, which is balance and coordination, and the frontal lobe, which is movement, through exercise, you can activate those two very important regions of the brain. This is why we talk about the top most important activities that can activate these different regions of the brain. They're going to be physical exercise, so physical activation, right? From that, we have cognitive activation, which is going to be memory-based games, crossword puzzles, Sudoku, meditation, like I mentioned, is another one. These can all help activate cognitive areas of the brain, right? And memory games can be something as playful as, playing Guess Who, which was an old game when I was a kid. You can play card games, trying to guess and memorize where different cards are located. There's a bunch of online games like Luminosity, things like that you can play to help train memory. And then we have chemical activation. And by chemical activation, I mean hormones. So the state and the health of your hormones. And for men, that's testosterone. And for women, that's estrogen and progesterone, right? And so I have a whole separate webinar where we're going to focus on women's hormone health and how those can influence different aspects of health. But for men, it's largely testosterone. And men go through andropause just like women go through menopause, right? And this concept isn't talked about a lot. But after 40, testosterone levels start to drop for men. And there's a lot of things that can be done to minimize that drop and maximize testosterone levels. And, testosterone replacement therapy isn't always the answer. In most cases, it increases your testosterone temporarily and then causes another crash in testosterone levels later. And a big reason for that is because the underlying root causes of your low testosterone were never looked into and were never addressed. And again, the chief therapeutic interventions that improves that is going to be diet, nutrition, lifestyle modification, and exercise. Okay. And then thyroid. Thyroid hormones play a huge role in activating the brain. And so we work with a lot of patients who have thyroid conditions, hypothyroidism, and one of their chief complaints is always brain fog or brain fatigue, right? So like I mentioned before, I do have a whole nother webinar on thyroid conditions. It does affect men, more common in women, but it does affect men, and it can influence your overall health big time. Now, let's review all these concepts. So causes of brain fog, again, we were looking at infection. We were looking at traumatic brain injuries or concussions. We're looking at autoimmune diseases, and we're looking at extreme psychological stress or extreme psychological trauma, right? And it may not be extreme stress. It may be chronic low-grade stress that's been there for years and years and years and is starting to weigh on you, right? Basic needs of the brain are fuel, oxygen, and activation, right? And I cannot stress these three concepts enough because this is almost always where we start with patients who come into my office, addressing and diving deeper into each of these things. And almost always we're able to correct brain fog and brain fatigue issues by improving these three steps, right? And we spoke about fuel being calorie intake, knowing what your basal metabolic rate is, making sure you're eating enough calories, and then eating enough protein each day. And again, optimal levels of protein are going to be 1 gram of protein per pound of body weight, right? And I try to recommend to people to get that from food, not from shakes all the time. Maybe 1 protein shake here and there, maybe 2 max through the day, but you have to try to get it from real food. Sleep when we talk about oxygen, we're talking about sleep apnea playing a role in decreasing blood flow to the brain, especially throughout the night. Blood pressure, too high of blood pressure, just as important as too low of blood pressure. And then a hidden anemia, meaning an iron deficiency or potentially a B vitamin deficiency. And then exercise, okay? The most important bang for your buck thing you can do for overall health, getting blood to the brain, getting oxygen to the brain, improving chemical activation of the brain, and physical activation of the brain is going to be exercise. Now, typically, what I recommend to people, you can couple cognitive activation and physical activation by learning new physical skills. That may be taking a dance class, learning a new dance or a new style of dance. That may be a martial arts class or learning a new physical skill, whatever it may be. This is why I like things like CrossFit, because CrossFit, although it's an exercise modality, right? They train you to learn new complex movements. And so when you get good and you get more fit, you learn a new skill, right? That may be like a handstand, or it might be a handstand push-up, or it might be swinging on a gymnastics rings, right? Things like that. We're taking a gymnastics class or a jazz class for adults, right? All those incorporate cognitive activation with physical activation. So you get the more bang for your buck. And if I take a step back here, you're able to activate more areas of the brain than just doing one single memorization game or a word puzzle game, right? I cannot stress that enough. Now, just to wrap this up, if you do have any questions come up, you can go ahead and post them in the chat. But because I was seeing so many patients with brain fog as one of their chief complaints, I created this online course, Fixing Your Brain Fog. And there's the link there. I'll give you a chance to you can take a screenshot of this if you want. If you want to save that link, you can write it down if you want. But I created an online course that dives deeper into each of these aspects we spoke about. It has a couple research articles in there, kind of reinforcing these concepts that I'm teaching you now. But it takes a much more in-depth dive into, if you do have low testosterone, what activities can you do to improve that? If you're a female and you have hormone imbalances, what can you do to address those? And so we take a deeper dive into that. I include a questionnaire assessment forms that will help you pinpoint what are your main underlying root causes of your brain fog. Is it autoimmunity, or is it low blood sugar, low calorie intake? Or is it maybe you're insulin resistant? Maybe you're in this pre-diabetic stage and no doctor has ordered your fasting insulin and blood sugar levels, right? You know, what's interesting is one of the earliest warning signs of insulin resistance can actually be high cholesterol, high triglycerides, which is the amount of fat in your blood. And there's a specific ratio that we look at, and when that ratio starts to skew, that's often an early indicator of insulin resistance, even before your blood sugar starts to creep up high, right? And if nobody has sat down and walked you through that or examined that for you, that's what we can do for you in our office. But the questionnaire helps you try to narrow that down. That's part of this course, right? It's an easy course. They're pre-recorded videos that I made with short lessons. It's about 3.5 hours of content, all self-paced. That includes, the questionnaires you fill out and everything. And it's a really easy, it is essentially, so in my office working one-on-one, my rate is roughly about $300 an hour. Okay. And so essentially the first 3 hours I spend with people is this online course. All right. So I figured if I'm going to spend the time doing this one-on-one with people, I could just build an online course, point people to that, and at least you can figure out the basic fundamentals first. And if you continue to have issues, now we can work and dive in deeper into what else may be contributing to your brain fog. Maybe it is autoimmunity. In that case, you do need to work with someone one-on-one to kind of dive deep into that and figure out what's causing that, what's contributing to that, where's the autoimmunity. That's often a big challenge, right? And so it's a great, I priced this at $149. And again, you can go to that link there. It's a bit.ly link. And I'll email it out to you all if you do have interest in enrolling in the class. Like I said, it's pretty easy to follow. It's quick, self-paced, but that's a resource for you all. Now, let's say you've done that, or maybe your brain fog is really bad. You've worked with a number of doctors already, and you're not getting any answers. Or maybe you have autoimmunity like Hashimoto's or hypothyroidism or something like that, and your brain fog is not getting better, even though you're being managed by medication and whatever it may be. Well, in that case, I would say maybe you need some one-on-one attention. And I do offer a free 30-minute consultation for all first-time patients, and we can do this virtually. I prefer to do it in person in the office, but if you're not close by the Austin area, we can do it through a telehealth visit. And essentially what I do is I give you some pretty detailed assessment forms. We look over any blood work you might already have and look for underlying signs of what may be driving these root cause issues for you, right? So that's always an option. And you can reach out to me through our website, forhealinghealth.com. You can send us an email there and just mention that you watched the webinar and that you wanted to set up a free initial consultation. No problem. We'll get that set up for you. All right. So to close, like I mentioned, I'll have one webinar on a different health topic every second Tuesday of the month. This is not the specific order, but we have a webinar on holistic approaches to mental health, really focusing on depression and anxiety. And like I mentioned, all the latest research is showing the medication, right? Antidepressants aren't really doing that good of a job at managing most people in their anxiety and depression. And so we'll dive into what really helps the most and what underlying contributing factors that may be. But brain inflammation, neuroinflammation is one big driving factor. We're going to have a separate webinar all on thyroid and thyroid health and how to manage and improve that through diet, nutrition, and lifestyle. We have another one on female hormone health. So this is women who have maybe irregular cycles, really painful, debilitating cycles. Maybe they don't have cycles and they're supposed to be having PCOS, which is polycystic ovarian syndrome. We'll talk in detail about that. We have another one on gut health. So issues like IBS, chronic bloating, small intestinal bacterial overgrowth, things like that. We'll take a deep dive into that because we see a lot of people with those issues as well. And we have another one on prediabetes, diabetes, insulin resistance, and how to manage blood sugar for optimal health. All right. So thank you very much. Like I mentioned, check out our website. You can follow me. These are my social media accounts on Instagram as well as TikTok. And here is the link again for this